This is the first meeting, in-person meeting, with stakeholders across the continent to develop minimum metadata standards for meningitis epidemiology. And this will allow us to have data standards that can be used across the continent. Yes.
Why the need for the standards? Why are these standards so important? And what's the process of putting them, of developing those standards?
Most importantly, the disease we are dealing with is very significant, especially for children below age of 5. Is one of the major burdens. And why we need to monitor it is that the data is a very big component in disease management. And one, it allows us to manage the disease and outbreaks. Two, it allows us to assess the burden and assess the interventions like vaccination. It also allows us to develop standardization and comparability at the global stage. But it also allows us to assess the efficiency of the systems, the health systems in country, within the continent, but across the globe. But this is also the way we do it is that we can't do it as alone. As a country, you may have data parameters you're collecting that may be good in the context of that country, but when it comes to some diseases that don't have borders, yeah, we have borders, but these diseases don't have borders, so they transmit in and about. The management of these diseases requires a collective effort from across borders. And that means if we are going to do it, we should have data that syncs across. So that's why we have to develop a minimum data parameters that if I use them in South Africa, they can be used in Uganda. And when we see it as an Africa continent or as a group, as a society, all this data makes sense to all of us, and that they inform not only national strategies, but regional and global strategies.
It sounds like a very ambitious project, an ambitious scale. What does a network like phage contribute? Can it help a process like that of developing the standards?
We are at the cornerstone where management of diseases moves in tandem with the availability of data. And not any just data, but standardized data, curated data, okay? And the only way we can do that is to put standards that can allow us to have the minimum data we need. And phage, one of the global alliances in genomic epidemiology, stands as a pivotal point to bring us all together from across the globe, across the region, people that are burdened with these diseases, to allow us discuss in the context we know best, from Uganda where I come from the people I've met, Botswana, everywhere, and that it gives us a platform to express our needs in our own context. And it's very important that such platforms like phage exist, and they allow us at national but also at regional level to collaborate and pattern towards a common goal, which are the diseases we face.
How, this is a follow-up question, how easy is it to build that sense of collaboration among countries in Africa? Because not just languages that divide, but also cultures, systems that set up. Some have better systems than others. How easy is it to have that spirit of collaboration set up in?
It may not be a matter of ease, but maybe the how. It's very important to note that we live in a very diverse world, diverse mindset, diverse priorities, okay? But when you have bodies or initiatives like phage that set out objectives and say, I think this is what we want to do, yeah? How then does it talk to the person in Uganda who may not have the time, may not have the priorities, may not have the resources to develop it? So that's why it's very important that this is the first step. towards being easy. Do you have a platform where we come and discuss? And FEJ is a platform. Does FEJ have platforms where they can communicate their findings or their recommendations? Yes, so that's when regional bodies like Africa CDC come in, regional bodies like WHO Afro, and at the global level, WHO. But it starts from a platform. The platform makes it easy. And then we stretch out to who is important, the stakeholders, and every country, every healthcare provider, every researcher in this field is as important, but the platform is most important to express our views, yes.
Then the last question, what's the next big goal, the next big step for the meningitis working group?
I think as we meet in a sequence of events, we have to agree on what is important for all of us in this field of meningitis and what is relevant to the people managing this disease or this burden. And when we do that, and not only the team that is meeting here, in consultation with other stakeholders across the region and across the globe, we put up a minimum standard. Then the next step would be, how do we then integrate it in national surveillance systems, that when they are interfaced with a case of meningitis, to help them manage better, they need these data parameters. And they should know at the back of their mind, they are not only doing it for the patient in front of them, but they are doing it for the society around the patient. That is at national level. But also at national level, they are not only doing it for that country, they are doing it for the region where they are, and then the globe altogether. Because we know that the disease we are dealing with is cross-border. It can be anywhere, anytime, and anybody.